Acetaminophen Rectal. Acetaminophen Rectal is used to relieve mild to moderate pain from headache or muscle ache and to reduce a fever. Acetaminophen is a class of medication, as we have said earlier in our previous videos, called analgesics, pain relievers, and antipyretic fever reducers. It works by changing the way the body senses pain and by cooling the body. Uses of acetaminophen rectal. Acetaminophen rectal comes as a suppository to use rectally. Acetaminophen rectal is available without a prescription, but your doctor may prescribe acetaminophen to treat certain conditions. Follow the directions on the package or prescription label carefully and ask your doctor or pharmacist to explain any part you do not understand. Many acetaminophen rectal products also come in combination with other medications, such as those to treat cough and cold symptoms. Check product label carefully before using 2 or more products at the same time. These products may contain the same active ingredients, and taking or using them together could cause you to receive an overdose. This is especially important if you'll be giving cough and cold medication to a child. To insert an acetaminophen suppository into the rectum, follow these steps. 1. Wash your hands. 2. Remove the wrapper. 3. Lie down on your left side and raise your right knee to your chest. A left-handed person should lie on the right side and raise the left knee. 4. Using your finger, insert the suppository into the rectum, about half to 1 inch. In infants and children, and 1 inch in adults, hold it in place for a few moments. 5. Remain lying down for 5 minutes to prevent the suppository from coming out. And lastly, wash your hand thoroughly and resume your normal activities. Special precautions to be taken when taking acetaminophen rectal. Tell your doctor and pharmacist if you are allergic to acetaminophen or any other medication or any of the ingredients in the product. Tell your doctor and pharmacist what prescription and non-prescription medications, such as vitamins, nutritional supplements, or herbal products you are taking or plan to take. Be sure to mention anticoagulants, which are also known as blood thinners, such as warfarin. Certain medications for seizures, including carbamazepine, also known as Tegretol, phenobarbital, or medications for pain, fever, cough, and cold. Your doctor may need to change the doses of your medications or monitor you carefully for side effects. Tell your doctor or pharmacist if you ever develop a rash or skin blisters after taking or using acetaminophen. Tell your doctor if you have or have ever had liver disease or if you drink 3 or more alcoholic drinks every day. Also let your doctor know or your pharmacist if you are pregnant or plan to be pregnant or are breastfeeding. If you become pregnant while using acetaminophen rectal, call your doctor or your pharmacist. Some side effects can be serious if you experience any of the following symptoms while using acetaminophen rectal. Please call your doctor or let your pharmacist know. And some of them include red, peeling or blistering skin, rash. Acetaminophen may cause other side effects. Let your doctor be aware. Thank you.